Welcome to my channel Fundile Ngwenya, where we teach each other. Last time I was talking about the cervical cancer, which is the fourth cause of death worldwide. So today we're looking at the treatment options that we have. Please don't forget to subscribe, comment, like. So today I'm looking at the cervical cancer on the treatment options. The first option, if the precancer cells have invaded the cervix and is less than 75% of the transformation zone. When I'm talking about the transformation zone, I'm talking about the area that invade the cervical cancer, the cervix, the area. If it's less than 75%, we can do what we call chemotherapy. Chemotherapy is a use of extremely cold. We freeze the cervix to 0 degrees so that we enable the precancer cells to die. So we freeze the area. It's like a refrigerator when we are at freezing point. It's just exactly, we freeze the cervix so that the cancer cells die. After freezing, we give you a pad. As that water defrosts coming out, then the precancer cells will already be dead. And what will be left, there will be a wound. And that wound, we are expecting somebody to abstain from sexual intercourse for the next 6 weeks until healing takes place. And also we have got the second method, which we call thermal ablation. Thermal ablation, this one is we use dry heat, which is applied with a probe. There's a probe that heat is applied into the cervix for 20 to 45 seconds. It uses 100 to 120 degrees that heat. But the patient, you can't feel anything. You don't feel anything. You don't feel that heat. But the precancer cells, they die because of that heat. And also we encourage that after doing the procedure, you abstain from sexual intercourse for the next 6 weeks until healing process takes place. Those are the two easy way. If your precancer cells, I can see the area where they start and where they end, and they do not invade 75% of the cervical cancer area, the transformation zone. We do chemotherapy and thermal ablation. Then we have got lip. The one these ones, chemotherapy and thermal ablation, they can be done by a nurse. It's an easy procedure. Then we have lip. A lip is where it's called electrosurgical loop, electrosurgical excision procedure, whereby there is the doctor. Now this procedure is done by the doctor. Why choosing loop is because the precancer cells have invaded the cervix more than 75% of the transformation zone. Thereby, even if we freeze, maybe the precancer lesion will have invaded the inner part of the cervix. So we prefer to do what we call lip. How is it done? It uses a wire loop that is heated by electrical current to remove the precancer cells. Then the procedure is just a minor procedure. When it's done, you just feel like you are on menses. Yeah, there's no much pain. You feel like you are on menses. Then it doesn't take time. 5 minutes is enough. Then the doctor remove that precancer cells. Then that removal, we put it in a formalin so that we take it to the lab, so that the lab detect if the precancer lesions were removed completely. So that is lip. But if now, even if you want to have a baby, after these 3 procedures that I have talked about, in later years, yes, you are allowed to can have a baby. There is no problem. But however, if now you are at an advanced stage of cervical cancer, like I showed you the pictures last time, Now there is a cervix, we can't even see the opening of the cervix. It has already been damaged. Now we take what we call biopsy. A biopsy is take a piece of the cervix, we put it in a formalin again, and we take it to the laboratory so that they detect how far the cancer has spread to the body. If the result comes back and say, no, these precancer lesions are within the cervix, then we immediately remove the cervix. We do what we call hysterectomy, which is the removal of the uterus and the cervix. Or sometimes we might suggest to do the total hysterectomy, whereby we remove the uterus, the cervix, the ovarian, the ovaries, and the fallopian tube before the precancer lesions metastasize to other body organs. That one is not it's a minor, we can say it's a major operation, but however, your cervix is just like, remember I said it's like the size of your fist. So it's done, it's removed with the vaginal, or it's removed on the abdomen if you have got fibroids. So it's just as simple. It doesn't change how somebody view as a woman. It doesn't change your sexuality. What changes is you cease to go to menses, you cease to be pregnant. Those are the options. No pregnancy, no menses, but you'll be fine, you'll be a woman, nothing changes. However, if now the laboratory results, they say the cancer cells have invaded the other organs of the body, like the abdomen, this cancer, they spread so rapidly, or the walls of the vagina have been affected. So it's very difficult. Even if we remove the cervix, there is no use, because precancer cells, they've invaded other areas. The cancer is advanced stage now. But however, what can we do? We can do chemotherapy. Chemotherapy, where you are given drugs like cisplatin or carboplastin to kill the cancer cells in the body. Sometimes you can do radiotherapy, where they use the external, there is an external beam, where they use the X-ray beams to kill or shrink the cancer cells in your cervix or in any other part where the cancer have invaded the area. So that is radiotherapy. It's good to combine the two. We call it chemoradiation. You use chemotherapy and radiation at the same time. And also on radiation, we have got the internal radiation, which they call brachytherapy, some they may pronounce that way, where they put a device inside your cervix with that radiation to kill the precancer cells, or to shrink the cells. It uses a short circuit, because we insert inside your cervix to try to kill those cells. However, I'm saying, why should we get into that stage when we are saying every woman should know their cervix? Every woman should know, since now we have got machines that can see, that can visualize. Imagine we are using you are visualizing your cervix, in a sense that we can tell right there whether you have cancer or not, as compared to pap smear, where the pap smear is taken and you wait for result maybe 1-2 weeks or 1 month. But now we are saying we are using a camera to visualize your cervix, and we take a picture. Then we can tell whether you have cancer or not. So I would like all the women, if you are listening, or any man with a woman in the house who have indulged in sexual intercourse, to at least know your cervix know your cervix, how it is to prevent the cancer of the cervix, since it is the fourth disease in the world that kills women. So we are saying, let's prevent it. Let's go to any nearest clinic, any nearest hospital where they offer such services. Know your cervical cancer to prevent complications. However, we have got side effects of chemo, radiation, such as nausea and vomiting, vaginal pain, cystitis because of the inflammation of the bladder, early menopause. There are so many. Anemic, you become anemic. Why should we get to that stage when we are saying we can treat this condition as early as possible? Thank you so much. Please don't forget to subscribe, like, and comment. Thank you so much.